Welcome to today's Explainer. Today we're diving into a topic that affects, well, literally countless new mothers out there, but it's still somehow completely shrouded in confusion and, frankly, a lot of anxiety. We're talking about postpartum breast changes. It is an incredibly transformative time for the body. But hey, here's the good news. When we actually understand the biology behind what's happening, and we pair that with time-tested, holistic Ayurvedic care, we can absolutely shift from anxiety to total empowerment. So let's jump right in. Okay, let's dive into this. Here is our roadmap for today. We're going to cover 1. Myth versus reality. 2. The science of breast changes. 3. Foundations of tissue health. 4. The Ayurvedic approach to nourishment. And 5. Safety and medical guidance. Section 1. Myth versus reality. Addressing the elephant in the room. So does breastfeeding actually cause your breasts to sag? Right? It's that fear constantly whispered in parenting groups, and it honestly influences deeply personal decisions about how to feed a newborn. But is it actually true?
Now, what's really interesting about this is how the source material unequivocally, just totally, debunks the idea that breastfeeding alone is the culprit. The short answer? No way. The reality really comes down to pregnancy hormones. Long before a baby takes their very first sip, these hormones are actively stretching out the supporting tissues. Understanding this truth, that it's biological, is really your very first step to effective care.
Section 2. The science of breast changes, the biology behind the shift. Okay, so here is the internal biological process, broken down step by step. Step 1. Pregnancy triggers a massive, and I mean massive, hormonal surge. Step 2. These hormones actively enlarge the ducts and glands to prepare for lactation. Step 3. This rapid expansion physically stretches the surrounding tissues. And finally, Step 4. Postpartum, as milk production decreases, the overall volume just naturally drops. This loss of internal volume within already stretched tissue, that is what results in a loss of firmness. It's like a balloon naturally losing air. It is simple mechanical biology, absolutely not something you did wrong. However, the degree to which this happens isn't the same for everyone. It really varies. Several key factors shape the outcome here. Genetics and age, they play a huge role. How much weight you gain during pregnancy, your baseline skin elasticity, and even lifestyle choices like smoking habits all heavily influence your tissue resilience. Because your specific risk factors are completely unique to you, your approach to care should definitely be personalized too. Section 3. Foundations of tissue health. Supporting the body's recovery.
It really all starts in the kitchen. Did you know that consuming a protein-rich diet is absolutely fundamental for tissue repair both during and after pregnancy? It literally provides the building blocks your body needs to rebuild. Furthermore, drastic, rapid weight loss can actually exacerbate these tissue alterations. So, slow, gradual, controlled weight management is absolutely key here. No crash diets.
And what about exercise? Let's make sure we set realistic expectations here. Muscle strengthening exercises are fantastic. They target the area beneath the breast, enhancing structural support and improving your posture, which honestly visually helps a lot. But, and this is a really big distinction we need to make, exercise does not alter, regenerate, or enlarge the actual breast tissue itself. Knowing this distinction is going to save you from a whole lot of frustration. Section 4. The Ayurvedic approach to nourishment. A holistic path forward. This is our core focus, supporting natural tissue health from the inside out using centuries-old wisdom. So the crucial point here is that a lot of women, feeling pretty vulnerable about these changes, turn to chemical-based enhancement products. But the sources strongly warn that these are risky and they carry potential adverse side effects. In stark contrast to that, Ayurvedic herbal formulations offer a much safer route. By utilizing traditional botanicals, Ayurveda provides nutrients and antioxidants that safely support tissue health without exposing a healing, recovering body to harsh chemicals. Let's see how this builds into a really comprehensive strategy. Our source details a specific herbal combo pack, and honestly, the synergy here is fascinating. You have Satavari and Safid Muesli, targeting direct tissue nourishment. But Ayurveda knows you are a whole connected system, right? So Chulai and Antamol are included to enhance digestion, ensuring you actually absorb those nutrients. Guduchi steps in for antioxidative protection, while Chirata, Buyamla, and Falsa support your metabolism and natural nutrition. It's really the whole shebang, maintaining breast health completely holistically. And this brilliantly illustrates the whole Ayurvedic philosophy. Take Guduchi, for example. It isn't some magic growth pill. Instead, its core function is antioxidative protection. It helps shield the body's cells from damage, creating this healthy, safe internal environment where the body's natural tissues can actually thrive and recover. You're basically just giving your body the specific tools it needs to heal itself.
Section 5. Safety and medical guidance. Protecting your well-being. Now, we absolutely need to talk about self-monitoring. While structural changes are completely normal, certain symptoms are definitely not. If you experience a sudden onset of hard lumps, unexplained pain, skin dimpling, or honestly any strange bleeding or discharge from the nipple, these are serious red flags. They could indicate pathological changes. Please do not wait. These require prompt medical attention and evaluation. Furthermore, even when you're exploring completely safe natural paths like Ayurveda, getting professional guidance is absolutely essential. Because your genetic makeup is unique to you, you might respond totally differently to supplements than someone else. So always consult with qualified healthcare professionals and Ayurvedic experts before starting any new herbal treatments. This ensures your safety and prevents, just ineffective self-medication. As we wrap up, remember this powerful idea. True holistic health requires patience, proper nourishment, and professional guidance to safely support the body's natural journey. The journey through postpartum changes is entirely natural. Your body has done an absolutely incredible thing. By leaving behind the myth that breastfeeding ruins your body, focusing on foundational nutrition, and thoughtfully exploring safe Ayurvedic nourishment, you can actively support your health. But it leaves us with a pretty interesting question to ponder. If ancient Ayurvedic wisdom can provide such targeted, effective support for our most vulnerable postpartum changes, what other modern health anxieties could we solve by looking back at centuries-old botanical knowledge? Thank you so much for exploring this explainer with me today. Keep questioning and keep learning.